Okay, we're back for another video. In this video, I'm going to briefly discuss the lines of correction for both the pelvis, sacrum, and lumbar spine. There's some very good videos on the Blackboard site for videos for full spine that were created by Dr. Mullen a while back. Those are very good videos with great explanations on side posture, so use those as your reference for looking at videos in referencing side posture and hand position stuff. But I do want to caution that some of the lines of correction look a little awkward on those videos because of the angle of the video. So I'm going to try to clarify some of the lines of correction for both our lumbar and the pelvis. I'm going to start off with the pelvis, in particular the sacroiliac joints. As you know, the sacroiliac joints aren't straight P to A, they do angle out. They go medial to lateral on either side. So that needs to be taken into consideration when making the adjustments in side posture. So as you roll your patient in towards you in side posture, that SI joint, which is sort of at an angle like this on the upside SI joint with the left SI joint in this case. As I roll that joint towards me, that SI joint is going to plane out a little bit and it's going to be pointing almost directly pointing back towards us. So that joint plane line is almost directly back towards us. So when making a sacroiliac adjustment with the side up, whether it's a PI, an AS, ASIN, PIEX, no matter what the listing is, you must make sure your elbow gets in the P to A position. So for PI adjustment, I will still have the elbow P to A and the I to S, slightly I to S, but mostly P to A with that elbow going straight through the SI joint. So that elbow has to get in that position. Because you're on the PSIS for segmental contact point in the PI adjustment, that puts you above the axis of rotation for the PSIS or the sacroiliac joint. So just by pushing P to A, you will automatically make a PI correction. So the I to S is kind of minimal in that setup. When adjusting a sacrum P-L, remember the hand is pointing down towards the ground to stay off the PSIS. And again, as you roll your patient in towards you, that sacroiliac joint is pointing straight back towards you. So when you make that line of correction, elbow, try to get it low enough parallel to the table so you can push P to A. Straight P to A through the SI joint, which is again back towards you. Now, the downside SI joint, that SI joint now, as I roll the patient in, is directed almost directly straight down towards the table. So in doing a sacrum, in this case P-R side down adjustment, your line of correction is almost going to go straight down towards the table with a little bit of a direction back towards you. So on that setup, our hands are parallel to the spine. Roll the patient towards us, P to A. That line of correction is going to go down towards the table and slightly back towards us to make the correction. Looks like this. So my hand's going this way, that direction. Okay? For our lumbar adjustments, those are all going to be the same line of correction. It will only differ only in the disc plane line. I'm going to put the patient prone for a second. The disc plane line at L5 is oriented in the S to I direction. The disc plane line at L3, in this case, which you see is the one with the subluxation and the bulging disc, is almost straight P to A. And at L1, the disc plane line is slightly I to S. These need to be taken into consideration when delivering your impulse in the lumbar spine. Our line of correction is still P to A, I to S, and lateral to medial, but we also need to accommodate the disc plane line. So our impulse or thrust will have an arcing motion. Our P to A and I to S to accommodate the facets, so P to A and I to S, and then again at L5 it'll be S to I for the disc plane line. So that impulse will start off P to A and I to S and then finish S to I for the disc plane line. So it has an arcing motion through the disc. At L1, still a P to A and I to S motion with an arcing motion through the disc plane line. So P to A and I to S and stays I to S to accommodate the disc plane line at L1, which is slightly S to I. So in our setup at L5, tissue pull, secondary tissue pull with the fleshy pisiform, hand crossing the spine for a PLS listing. P to A with the elbow, P to A, I to S, L to M, has that slight arcing motion, and of course PLS, and I would torque it closed, the wedge closed, but P to A and I to S like this. Remember that arcing motion. That's for all the lumbar vertebrae. Take a minute, practice those with your dry spine or partner. Remember your disc plane lines, your P to A and I to S for lumbar spine, and take into consideration the angle of your SI joints when doing a side up or side down adjustment. We'll see you on the next video.